I'm going to, at this point, introduce Dr. Robert Steele. I've known Dr. Steele for a few years. He is a product of Michigan. He graduated from the University of Michigan undergrad as well as medical school. You must excuse him if he left the state for a brief period of time for his completion of his training, but he returned to Michigan, and he is a board-certified cardiologist. He is one of the founding members of Michigan Heart, which has as his home office, if you will, in Ann Arbor, Michigan. And I did not check this out, but I think it's safe to say that Michigan Heart is probably one of the largest cardiology groups in southeastern Michigan. I think that's a pretty safe bet. I will share one particular insight about Dr. Steele that may not be immediately apparent to you. Dr. Steele is a rather accomplished physician, obviously, but he also has a passion for automobiles. And when I say a passion, I mean a passion from racing, from restoration, from getting his hands dirty as a mechanic. I've been in his office a few times, and everywhere around that office are automobiles, models. So this is a man that obviously has a Michigan root that runs far and deep. Dr. Steele, as you probably know, has been very busy lately, but he has taken time out of his very busy schedule to come and talk to us from a perspective that perhaps is a little unique. We certainly have heard from business people, we have heard from lawyers, we have heard from politicians about what health care reform legislation means. But Dr. Steele is here today to tell us a little bit about the physician's perspective. Dr. Steele.
Well, thanks everybody, Michelle and Tom, who helped organize this, everybody that's come to support the chamber. It's a critical function in communities like Monroe that have a long history of success and a long history of successful businesses and depend on themselves and the entrepreneurial spirit and the hard work of folks here to keep that going. So congratulations all for being here and supporting the chamber. This is a big, all their meetings like this are fundraisers, so thank you for being here. And Jim, I've known Jim for at least 15 years. And yes, I am a car fanatic, though I haven't had a lot of time for that. I have no bad wrecks in the racing world or anything like that, but now with 4 kids, my wife has come from a big auto family as well, and my son is insane about racing. He races all the time, and he always is complaining, well, you didn't let me do it when I was younger, so now I can't be a professional. Hey, you know how you make a small fortune in auto racing? Start with a large one. Yeah, there. So I know we've got some video cameras here, so I want it to be absolutely clear. I haven't served in the armed forces. I haven't ducked fire jumping off helicopters, none of that stuff. I'm a practicing cardiologist and have been up in private practice since 1987. Yes, we are the largest cardiology, sole cardiology practice in Southeast Michigan. We have 7 offices in 5 counties. And so I've not only been practicing there and done, on the order of 18,000 cardiac procedures, interventions, stents, and all those sorts of things, but also helped run that practice. Been on the board forever, basically, and run the finance. I'm the chair of the finance and also benefits. And so when I talk about some of the things I'm going to talk about, it's practical application of what it means for businesses. I'm not, working on talking points. I'm not working on what somebody might think. I'm going to tell you a little bit about the practical experience that we've had, in the practice that I've helped build and run the benefits for with about 30 cardiologists, 30 plus cardiologists, and approximately 300 employees. So, I understand the benefits part of that fairly well. So, when we talk about this healthcare program, the first thing you got to step back is to figure out, well, why did we do this? And so I'm going to make just a couple of quick comments on some of the things that you heard in the press and on the news and from various locations saying, hey, this is why we need to pass this bill. And a lot of you have heard a variety of things, and you've heard a little bit about why are we doing this? Because of all the uninsured. And there's no question we have some problems in our healthcare system that could be improved. The unfortunate part is we'll cover here that this healthcare bill does absolutely nothing to fix any of the problems that we really have. It makes almost all of them dramatically worse, which is just absolutely a disaster. But we've got a couple of different parts of the Health Care Act, and we'll cover that, but there's a whole uninsured question, and there's no question there are a bunch of people who are insured in the United States, but when you really cut through all the numbers and you go through who can afford insurance, decides not to, and this sort of thing, you come down to somewhere in the vicinity of 7 to 9 million chronically uninsured who literally cannot afford it and can't get care. And so that's a definite problem. But you could give each one of those 7 to 9 million the best Blue Cross policy there is, and it would cost, a couple $100 billion compared to the trillions that they're talking about spending here, not to mention the loss of control. You hear a lot about the poor quality of health care in the United States, and that, of course, is an absolute joke. You hear a lot about the statistics for how we rank in the world. And so what they always do is they tell you we rank like 36th or 7th or something like that when they compare the different healthcare locations in the different countries and the different systems that exist. But most of the things that they use for criteria in that ranking, one of the criteria is there a national health care plan? Well, I guess that doesn't help us in the rankings there. But in the only part of the ranking that's related to actual medical care, we actually rank number 1. And so what they want to do in all of these things, or for example, like another big one you hear about is the high birth fetal mortality and infant mortality, and that's another one of these lies, damn lies, statistics that Mark Twain used to talk about. Many of the places that are touted, as fantastic places for healthcare, like Cuba, for example. You notice how the sheiks and all the wealthy people from all over the world flock to Cuba to get their medical care? It's incredible, isn't it? And in fact, some of these people, the super wealthy around the world, have actually bought hotels in Cleveland next to the Cleveland Clinic and in Rochester, Minnesota next to the Mayo Clinic, because these people know where the best health care is in the world, and they come here to the United States to get it. But when you look at some of these things like fetal mortality and so forth, Cuba, for example, doesn't report any births unless the baby is alive for 48 hours. United States, if the baby's delivered with a heartbeat, it counts, no matter how premature. So maybe they're 29 weeks, 30 weeks, weigh a pound. That's a live birth in the United States, and this is the only country where that's a live birth. And of course, we work to try to keep those babies alive in most cases, and in all the other countries, they have a variety of different ways of keeping track of fetal mortality. But if all of those other things applied to us, we would be right near the top. And then you hear a lot about the cost of health care and how we spend such a high percentage of health care, of our GDP on health care. Well, of course we do. It's a luxury item in many cases in terms of high-end care. And we're one of the only countries that's wealthy enough in the United States to say we're going to spend our money on that luxury item. I mean, if you look at almost anything in the United States, we spend more of a percentage in our GDP than any other country in the world. Automobiles, yes. Housing, yes. Electronics, yes. Healthcare, yes. Most countries, the citizens are scrapping by to be able to get a roof over their head, food in their stomach, and just the simplest things of trying to be able to survive. So when you have disposable income, people choose to spend it on what they choose to spend it on. And in the United States, a large part of what people choose to spend their healthcare their money is on healthcare. So you have to have extra money to be able to drive that up. So all this stuff, especially, that's one of the most irritating ones when they talk about, how in Sweden or Great Britain or here and there they spend 10%, we spend 16 or whatever it is. It's just a joke. You can take any industry you want, and we spend a higher percentage of our GDP, compared with them. So, a lot of this stuff is absolutely the reasons that they wanted to put it in just don't pass the common sense test whatsoever. But there are some definite problems, and when you look at where our problems lie in excessive cost, we have a couple of big ones. We have fraud. We have a lot of healthcare fraud, and there was a recent report last fall, actually, by Thomson Reuters, and Thomson's a big financial services giant throughout the country, and their healthcare division happens to be actually located in Ann Arbor. And last fall, they had a massive white paper on research of where the money is wasted in United States healthcare, and they found that 40% of it was in unnecessary care, and And they figured, in the way they had it calculated, that was about $250 to $300 billion in unnecessary care, and they tied almost all of that to unnecessary malpractice. There was also some that was in unnecessary prescribing, like antibiotics. You go into your doctor, you got a viral infection, and it happens. I'm telling you, there's no question. The patient keeps coming back. I need an antibiotic. I need an antibiotic. You don't give it to them. They go to somebody else. They get an antibiotic, and so that happens. There's no question. So the single largest part of unnecessary care is related to malpractice, and there's no tort reform in this bill. And the interesting thing is that in the state of Michigan, we had very strong tort reform in 1993, and our malpractice premiums have dropped unbelievably over the last 10 years. And Jim, who works with our firm, and our firm is characteristic of many private firms in whatever industry you're in. We have our own QA department within our practice with some of the partners and some of our administrators. We invite Jim as our attorney. We invite the insurance company. We review any cases that we think weren't handled properly and all this sort of thing. And our insurance premiums have plummeted. And when you look at the other states where there's been major malpractice reform, like Texas and Oklahoma, physicians are rushing into these states. They've gone from physician shortages to the number of physicians moving into these places. It's incredible. And so, in the healthcare bill, there's no significant tort reform. They want to say there's demonstration projects and this kind of stuff, and that's an absurdity because the states of Michigan, Texas, Oklahoma, and many others have already done the experiment. It's done, the data's in, there's no question about what the answer is if you have all the cases reviewed ahead of time by physicians and attorneys to say, is this a reasonable suit or not, and you screen out all the ones that are a joke, the costs drop immediately. And so that's already been done. And of course, Michigan, we already have that, and we're happy to tell other people about it, but the federal government doesn't want anybody to know. Then another thing we have is healthcare fraud. Fraud's huge. Thomson Reuters expects somewhere in the $125 to $175 billion of fraud, and many of you saw the 60 Minutes thing on healthcare fraud, where they were talking about $60 billion in healthcare fraud in the southeast United States alone. And of course, that was in Medicare. Now, you would think, if you were in a situation where you could prevent that healthcare fraud, you would probably do it, right? That was Medicare. And now all of a sudden they're going to do it? I mean, what are these guys doing up there? They've got all this healthcare fraud happening already. They haven't done anything about it all these years, but just now with a wave of the wand it's going to be better? I don't think so. The healthcare fraud's an organized crime activity where people stealing billing numbers and patients and numbers and all these kinds of things, and with storefronts, no doctors even involved. Of course there are doctors involved in healthcare fraud, but it's actually a very tiny amount. Most of them are just, people steal the numbers and just start sending in bills, and Medicare pays them. So healthcare fraud, that's about 20% of the waste. Administrative inefficiency, that's a big one, of course, and there's a lot of redundant paperwork, there's no question. Now, you hear the people in government say that by having this health care bill that we will have a reduction in paperwork, and they go for single payer, and they talk about how many people have ever done anything with the government compared to your store or private business down the road where there was less paperwork with the government than with your private enterprise down the road. I mean, it's an impossibility. To think about when you go in to see Tom at the bank or somebody else to go do something, and you have a loan or something, and it's a couple of pages, and you feel, hey, I can read that, and I can look at that, I can talk with them about it. How about if it was 2,800 pages of unintended consequences? I mean, when you go to talk to your insurance company, you'll find your contract with your insurance companies is just a handful of pages, single digits pages. And now they want us to have a contract that's 2,800 pages. Which one would you be more comfortable dealing with? Which one do you think is going to be able to bring more to bear? And I will tell you, the amount of paperwork, I can just give you a great practical experience that I had just the other day on a patient who I'd been seeing for about 12 or 14 years. And they were on this combination of drugs for 12 or 14 years without any problem. Well, somebody gets the bright idea that in about 1% of the time with these particular drugs, there's an issue, and you need to have it pop on the computer, and the insurance company flags it, and that means some high school student gets a thing that pops up on their computer that they need to call me, who's been in practice for 30 years, and say, hey, don't you know you're not supposed to be using that? And so then I got to have my nurse pull the chart, do this, dictate a letter, send it back to them and say, well, we've tried the other 12 things over the last 18 years, and they've been on this one for 12 years already, and they've not had that problem, so we don't need to change it. And so then what happens 6 months later? They send the same letter. So get rid of that, and that's because a lot of times, I mean, it literally is a high school student, a graduate, with a checklist saying, "Look, you missed the checklist. We better get these guys with 30 years of education and all this experience with the patient in front of them, you know, and deal with that." So that's going to be insanity, and it's just going to get dramatically worse. Especially, I'll cover a little bit more about why it will be so bad. In their healthcare provider errors, they figure that's about 10% of the excess cost in the whole situation, and they say preventable conditions are about 6% of healthcare waste, and then lack of care coordination. You hear a lot about the electronic health record, and I can tell you all about the electronic health care record. We've, in our practice since the 90s, have had a limited form of electronic record, one of the first in the country, and we've had full-blown electronic records since 2004, and this is what I can tell you. Our costs have exploded, our efficiency has dropped dramatically, and we've seen no significant change in our quality measures, other than that we can keep track of the ones that we were already doing, and that's a benefit. It's certainly a benefit when certain things pop up regarding drug interactions, so that they can tell me, it pops up and it says, you might as well just say, if you go ahead and prescribe this, you're going to start getting a series of letters every 6 months and have to spend, you know, who knows how much money having your staff deal with these people sending it back. That's what the pop-up should say. It shouldn't say there's a 0.5% chance of a certain interaction. But this electronic health record thing, in the long run, it may be helpful. I can tell you that right now, today, it is a massive cost. I mean, do you think it's cheaper to have somebody who graduated from high school to file an electronic record or to hire IT guys? Let me tell you, IT guys are a lot more expensive than people who you can hire that know the alphabet and know how numbers work, right? And so that's incredible. There are definitely some advantages of an electronic health record. If I'm at home, I can log into our computer and I can get these records and that sort of thing, and that's fantastic. But you know, all the things that the government does, whether it's HIPAA, the Healthcare Insurance Portability and Privacy Act, which, you know, every name is like the Patient Affordability and Privacy Act. They're all 1984 Orwell names. The Health Insurance Privacy Act, Portability and Privacy Act, actually guaranteed a loss of privacy for your record, because that bill actually guaranteed that the government and the insurance companies were allowed access to your record. It's incredible. And that sort of stuff is absolutely rampant in this other bill of 2,800 pages. So when Thomson Reuters, and I spent a little too much time on this, but I just want to really lay out for you what we have to deal with when you get reports on the news and when you have politicians or the government bureaucracy who's going to gain and benefit. I mean, isn't it the same for everything? You always got to look, well, who's going to benefit from this? And so that kind of stuff is absolutely crazy. And so Reuters does think there's almost $1 trillion in waste. But this healthcare bill might at the most get 6% of what an independent group thinks is involved in the waste. Okay, so what else is going on here? You know, it's a massive, massive topic. Well, let me just make a couple comments. The healthcare bill actually originates back in the stimulus bill in February of 2009. And in February of 2009, a couple of big commissions were created and funded with billions and billions of dollars. And that was, one of them was the Health Information Electronic Exchange Commission, and the other one was the Federal Commission for Coordination of Health Benefits. And these two things are critical to making the whole health care plan work. And these were back in February 2009, kind of under the radar, but this was the foundation upon which the health care bill passed in March of this year was built. The whole electronic information thing and the electronic record, there's one reason for that and one reason only in the short term, and that's so that they can have access to your care, so that they know if you're following their guidelines that will be promulgated by the other twin, the Federal Council for Coordination of Health Benefits. And so a lot of you might remember not long ago there was a big brouhaha about mammograms and screening for mammograms and all this kind of stuff, and everybody was in an uproar about it. They changed the criteria and all this, and that was the first salvo in this kind of committee, because the way the law reads is that anything that was fitting a certain category of benefit at the time the law passed was automatically codified into law, and that was the first one they tried to slip in prior to the law being passed, and there are many others, of course. But you know, it's amazing. So when you get into this electronic health thing, that they really just want to make sure they can have access and follow the care and make sure that you're doing what's been told to be the right way to do it. They've just had this big brouhaha, and I've used that word twice today, and I hadn't used that word in probably 10 years. Good audience for that, I don't know. But it's amazing what's happened already. Just the other day, some of you might have seen, there was a big comment from the guy who's in charge of the electronic health exchange, appointed by the government, was saying, well, you know, things like abortion and AIDS, you know, status don't have to go in the electronic record. Well, most states have a law that those things are required to be in the medical record. And so it's already being politicized because there's different factions, and that's just the first salvo. That was just the first two most controversial, and that was just last week. But these things will come fast and furious with the politically correct or politically incorrect diseases that someone's got, you know, a bee in their bonnet about. So that was just the first one, which already absolutely conflicts with state laws for almost every state. And then they act like it's between the patient and the doctor as to what goes in the record when it's already a matter of state law. Because, of course, the federal government doesn't want to take responsibility for actually having all these things happen that people said were going to happen, that they said weren't going to happen. When they will happen. Don't worry. Did you follow that? I know. Yeah. So that's one that just happened. There's going to be all kinds of stuff, but one of the biggest problems with healthcare, and this is the real reason, there's two reasons why they wanted to pass healthcare so urgently. One is because they want to have control over everything. You know, there's obviously an inverse relationship between, you know, personal liberty and freedom and control by the government. Those are inversely related. And it's amazing how the right to privacy seems to have disappeared in this whole discussion, whereas in other discussions it's of paramount importance. But that's one reason, control. The other reason is because Medicare is an absolute disaster. I mean, Medicare is so broke you can't comprehend it. It's way more broke than Social Security, with unfunded liabilities of the $38 trillion. That's the lowest estimate. $38 trillion, that's with a T. And they're talking about this bill being $1 trillion over 10 years. 38 trillion in unfunded liabilities. And so of course all these guys that have totally destroyed Medicare and put into place all these rules and a practice, you know, method and rules and so forth that has led to 38 trillion unfunded liability, well, they want to dodge that one, right? So they got to pass something before we find out how bad it is because they were responsible. Okay? That's the real reason why I had to rush through, because of course this was their golden moment to do that. They've got some other great groups that have been formed. There's the independent, let me see if I get the Independent Payment Advisory Board. This is an independent group, but oh, by the way, the Independent Payment Advisory Board, which is, you know, codified into law, has already been staffed, as has the Federal Council for Coordination of Health Benefits. Those have already been staffed with 15 people. No practicing physicians on that group of 15. Okay. How's that work for your daily care? No practicing physicians on that. But the Independent Payment Advisory Board, which has been put together and is also codified into law, that will control how much money is spent. Except they exclude the hospitals and the hospital testing, leaving only the physicians. Now, many of you who move from one place to another might have already discovered that it's harder and harder to find a physician who will take a new Medicare patient. And that if it's a Medicaid patient, forget about it. I mean, in our practice, Medicare pays about 38 cents on the dollar, and Medicaid about 16 cents on the dollar. And one of the things that they talk about with all these uninsured that are coming, that they're going to tell you about all the people who are going to be insured now in the upcoming bill, you know, from 30, they're going to say 16 million people are going to be insured. Well, 16 of the 30 million that are going to get insurance will be Medicaid. There's already not any doctors to see Medicaid patients. I mean, there's already severe rationing by the government for patients in Medicaid because there's no resources available. And to make it even worse as regards the Medicaid payment, it's a mandate to the state. Now, how's the state of Michigan doing right now financially? We probably need some more big federal mandates, don't we? We probably need a big expansion of, because Medicaid in the state of Michigan is our big unfunded liability. I mean, it's, you know, pensions are obviously big, but Medicaid is the big one. So, you know, there's just so much that we could talk about. So let me just quickly here as we wrap up, let me check my my watch here. Well, you get to keep your health insurance. I mean, how many people have heard if you like it, you can keep it? And the answer to that is no, you can't. If you have Medicare Advantage, that's already been legislated out. If you have employer-supplied program that you like, that will immediately start to go away because the health insurance commissioner is going to design the plans, and all the private plans have to follow what the health insurance commissioner says is the way that insurance is supplied. And so, for example, the plan that we have in my practice covering 300 people, where in the last 5 years our health care costs have gone down. How many people have heard of a company from the national news of a company of 300 employees where the health care costs went down? Of course you don't hear about it, because that wouldn't fit the fact that we need to blow up the whole system. And the fact of the matter is everything we've done to control costs will be against the law by 2014 to 2016. Now, some of them aren't against the law in that it says you can no longer do this. Some of them are against the law and it says you can no longer make contributions to that kind of plan. Some of it says if you change your plan, it is no longer grandfathered and you have to go to the new government plan. And so, for example, our plan is now frozen. We can't let any new employees into our plan, because if we start to change our plan, then it will no longer be grandfathered. And that's just for starting here by 2013, and then 2014, all the plans have to comply. So will you get to keep your plan? Absolutely not. High deductible plans will be gone. Health savings accounts will be decimated. Your contributions will go lower. Flexible spending accounts have been decimated. The limits to those have been put down to $2,500. So, for example, if you're someone who has a disabled child and you're trying to sock away money pre-tax to help care for that child, gone. 25 max, no matter how much you were spending before. So there's all kinds of things like that. In terms of the physician side, I'll skip that. Businesses, let me just say, the National Federation of Independent Businesses has come out strongly against this plan. Many of you may belong to that organization. If you want to look in the Wall Street Journal on May 27th, a couple months ago, May 27th, Wall Street Journal, the head of the National Federation of Independent Businesses had an op-ed there. But for most small businesses, what you will hear touted by the health care plan is that there's all kinds of tax credits available for small business. Almost 80% of the small businesses are screened out of eligibility just on the first 3 criteria, not even hitting the 4th criteria, and that's based on the number of employees, that's based on the amount of money they make, and about whether or not you supply health insurance to them, and how much of that price you pay. And so it's an absolute disaster. It's incredibly complex. It goes away after 6 years, but will your health care costs go away after 6 years? Will this bill be gone? No, only if it's defunded or repealed. I'm not going to talk about that. It's a good idea, though. The other thing they'll have is a health insurance fee, and this is critical. And this is up to $14 billion by 2018, all paid for by small businesses, because self-funded insurance plans, like the large businesses and the unions and so forth, people that have enough money to gather enough money and self-fund their plan, are exempt. So it falls only to small businesses, and that's going to be $8 billion ramping up to $14 billion. The other thing it does is all businesses will now have to have a 1099 on every transaction between businesses on over $600. Can you imagine that? Think your business dealing with another business having to have a 1099 for every transaction over $600, because they want to be able to tax that money to try to help pay for this plan, which is an impossibility. The other thing that small businesses will have to do, they'll have to report the value of the health insurance on the W-2. And let me say right now, there's a lot of things going around the internet on how your taxes are going to go up because of this thing on the W-2, and that's a myth. That is not true. And so when you get that one on the internet, know your taxes right now aren't going to go up because that shows up on your W-2, but it is reported on your W-2 because, of course, the government has to be able to keep track. Are the businesses following the rules? And then, of course, down the road, when they see that they're going to have to tax that money, they'll already have it set up. Right. But right now, absolutely not. It will show up, it will not be taxable, despite some of this misinformation on the internet that you might get from some well-meaning friends. So what would work better? Michigan's had tort reform already. There's no question about it. And you hear a lot also about the insurers of last resort. We have that in the state of Michigan, Blue Cross Blue Shield, insurance of last resort. And that whole issue of you can't buy insurance of last resort, that affected like 9 to 10 million people in the entire country. That was one of the biggest arguments. Our practice, healthcare costs gone down over 5 years, flexible spending accounts, health savings accounts, high deductible plans. We pay the deductible, almost all of it, for our employees. But here's the trick, and it is that a low deductible, gold-plated plan, which has no deductible, when we went from low to high deductible, when we went to a $5,000 deductible, the health care cost, the health insurance premium went down by $8,000. Because these health insurance companies, whether it's a $5 bill or whether it's a $5,000 bill, they still got to shuffle the paper around. And if they know that they don't have to shuffle the first $5,000 worth, their costs go down dramatically, and so that all happens. But here's the single biggest number that they don't want you to know and why this isn't going to work. And that number is 12, and that's the number of 12 right now is the number of cents that the average healthcare consumer pays for every dollar of healthcare consumed. Now, all I have to do is ask the ladies here, if you were given a Nordstrom card, and you could spend whatever you wanted and were responsible for only 12 cents, how would you do? And if you were a guy heading to Lowe's or Home Depot and you could spend whatever you wanted and only had to pay 12 cents, how would you do? And this new health care plan is going to drive that number even lower. And the cost will explode, and I don't have time to go into all of that. And I think I'm gonna stop, and I think we're gonna have some questions. I know people were submitting questions up here, and Tom, you're gonna
I'll just go ahead and read the first one. And you've already commented on some of these, but I want to give you a chance to expand a little bit more. The question was, what are some of the unknown provisions in the healthcare bill that no one's heard about yet?
Well, I might have covered some of those on the business end, but things you just heard the other day, that one of the things that's going to be required to be recorded in your healthcare record is your BMI, your body mass index, is a combination between your height and weight. And how many people saw the thing going around the internet about a year ago where it was like ordering pizza in the future? Where you called the number and you ordered something and they said, no, you can't have that, your cholesterol is this. No, you can't have that, your weight is what? No, you can't have that, it's too far for us to drive, it'll use too much gas. And that guns, gun rights are a huge issue and a huge topic, and there's already administrative rules that are saying that they can mine the electronic health record for certain diagnoses that will exclude you from being able to buy a gun. There's one that most people don't know about.
This question takes us a little bit in a different direction. It says now that the administration has declared health care is a tax, the cost will be a tax. Is this tax discriminatory since it exempts unions and others?
Well, the unions, they're for the next number of years, up until 2018, they're kind of semi-exempt in the sense that the what they call Cadillac plans are exempt. And of course, the problem is that there's no reason for Cadillac plans. I mean, I'll just go through one more time this example of my practice. 5 years, our costs have gone down with a high deductible. We pay most of it. So for our employees, they contribute every 2 weeks, plus they have to pay $1,000 of their deductible. But when you add in together all of their every 2 weeks, plus their $1,000, if they used it all, they may or may not, that total is dramatically less than the average employee pays at the University of Michigan for their gold-plated plan in their bi-weekly portion only. Because most gold-plated plans are prepaid health care, not insurance. And so the whole union thing is based on it being an expensive care. But let me just explain to anybody who might be in the UAW, it has Aviva. They traded a lot of these shares of stock for Aviva, and they unloaded a lot of the benefits. That Aviva does exactly what we do, because it's the only way you can make it go, because that's the way it costs less.
This question is about HSAs, healthcare savings accounts. Are you aware of any changes upcoming?
Yeah, I touched on that just briefly. Health savings accounts are an amazing thing because I'll just give you my own example. I've got 4 kids, wife. If I had been able to have a health savings account from the time I started in my practice 24 years ago until now, I would have over $150,000 in my health savings account. Now, if I had at age 52, $150,000 in my health savings account, would I worry at all about what the government said or did? No, I would be completely independent. Of course, that is their fear. And so what's happened with health savings account is first off, there's a big new tax on health savings account. If you take the money out, the tax has been doubled from 10 to 20 if you use it for things that aren't qualified. You can no longer use it to buy over-the-counter drugs, which you used to be able to do. And also the amount that you can contribute has gone down. But the real way they're killing health savings accounts is all the plans that you will be able to buy that will be put into place by the health insurance commissioner. None of them will have high deductibles. the need for health savings accounts will be legislated away, well, won't be legislated, be regulated away. And that's the biggest problem here, let me just say. Unelected bureaucracy is who's going to be in charge of your care. And, yeah, I don't want to launch again on that one.
This question is about the potential healthcare credits for businesses in Michigan. It speaks to, makes the comment, healthcare costs have been a great burden on small businesses for years. Reports are that there'll be tax credits available for small businesses in Michigan. Do you think this will help small businesses create jobs and keep their best employees?
It would be great, but the best way to keep your employees is go to a high deductible plan and help them pay part of the deductible because it will cost you dramatically less. I mentioned the healthcare or the small business tax credit, and this is what it is. You have to have under X number of employees, and it's different. If you have under 10 employees, they make a certain amount of money, and you pay more than 50%, they'll give you a 35% credit, but that expires in 6 years. And that changes depending on the size of your business. If you're a larger business, then there's a $2,000 penalty, but the fact of the matter is the penalty is not big enough, so most large businesses that supply health care will be far cheaper for them to pay the $2,000, send all their employees to the government health exchange, and let you pay for it.
Again, this one is a little bit different direction. It asks about the new technology, and do you see any changes in how healthcare will be delivered in the future? And it specifically talks about PDAs, handhelds, that sort of thing.
Yeah. Well, technology, we're talking about electronic-based record, and we do all these things. We have, when I'm making rounds in the hospital, I have a laptop with me. And I'm logged into my database for the hospital. I'm logged into the database for radiology, for my practice, for all our testing. And so I have all that information available. The fact of the matter is, though, is it reduces efficiency so dramatically that care is automatically being limited because, for example, there's all these new regulations that came into the cath lab of all these things that we had to do that decreased our efficiency by about 20% to prevent something that I haven't had happen in 18,000 cases. And so automatically we've had a 20% reduction in efficiency, same number of employees, same amount of time for me, but we cannot get the work done because we have to do so much extraneous documentation. But as the first part of the question was about technology as well, and so not getting over to medical technology, there's a new R&D tax. And in the United States, we have the most amazing technology. It's unbelievable what's happened in the 20-some years that I've been in practice in terms of technology and life-saving techniques and things that just you can't comprehend. But there's now a new tax on that, so that's going to slow down immediately. Most of the big companies have put aside at least $200 million to pay for this. So that's money directly out of their R&D budget that will go into paying this tax. And I want to make one other comment because I haven't said anything about this, and I think that's the last question. Yeah. Yeah, we've got to go. I want to say one thing about the new CMS head, Don Berwick. And Donald Berwick is the new person that's the head of the Medicare, CMS, Centers for Medicare Services, and he was not even put up for a approval vote by the Democrat-controlled Senate committee who was in charge of him. And it's very obvious why, because he's a lover of the British National Health Service. He compliments them dramatically on rationing care. And he says the way you have to do it is you have to set the availability of care just below demand and then manage the demand. And you have to limit technology and ration technology. And in fact, if you just go last couple of days, couple of big reports out of the British Health Service, how they're collapsing and that they are having all these new rules to try to save care, kicking the terminally ill out of the hospital. For example, they have long waits in the emergency room. So they passed a law where you can't wait for more than 4 hours in the emergency room. Well, they didn't have the staff to be able to get them out of the emergency room for them, so what do? They closed the doors of the emergency room. They wouldn't let the ambulance into the emergency room. And so then all the ambulances were filled with patients who couldn't get into the emergency room, so when you were having your heart attack down the road a ways, there was no ambulance available to come and get you. There's goods and services and supply and demand, and there's all these things come into this. And all I can tell you is when they say they're going to save $500 billion out of Medicare, when 40% more people are coming into Medicare, that's not happening.
There were a few more questions, but they're all similar. They're less about health care and more specific to your candidacy for public office. And in most of these cases, the people left their name and address. I'll leave it to you. You can respond to those if you like. But again, they were more asking about who you if you align yourself with any candidate for governor and so on, and
I could stay after, and people can, I don't know what time it is, but I know people are expecting to leave,
Right.
so.
I was going to suggest that really wasn't the purpose of today's program. It's more about healthcare education, but I'm sure Dr. Steele will be glad to answer those questions later. So, any final comments?
Yeah, I just want to thank everybody for coming out to support the Monroe Chamber. You know, the success of the United States is built on small communities like this. I'm from a small community that just lost 2,800 jobs, UAW jobs, up in western Michigan, Greenville, largest refrigerator plant in North America. And I understand what's going on in southeast Michigan with all these loss of jobs. So you're all to be commended to come out here and support the chamber, band together as a community, and work to create jobs and take care of yourselves. And quit expecting the people in South Carolina to do it.
Thank you, Dr. Steele. We appreciate you being here. It is very enlightening. The only final comments I'll make, I just want to make sure I mention our sponsors again. Manick and Smith, Robinson, Curfew, and O'Connell, Monroe Bank and Trust, and Monroe County Republican Party. So again, thank you for all your support.